Dr. Shadan, hi.
Hi, كيفك؟
I'm very good. After the response of the last episode, we're very happy to start the second episode of our beauty talks. And like we promised last week, we will be talking about the eye area, how to take care of it, what are the factors that keep it healthy, that keep it youthful, what to avoid, what not to avoid. Let's start with the physiology of this specific area in our skin. Why is it so sensitive and why is it so prone to premature aging?
There are several factors that make this area age very early. It's one of the earliest area that we can see the aging signs visible on. Number one, because of the movement. We know that we blink, we use the muscles around the eyes like 10,000 times every day on a daily basis. This is number one. Number two, also because of the thin skin that is there on the eyelids, we know that this skin become loose very early during the aging process. Those are two factors that are really very important. In addition, the nature of the tissues that are underneath the skin, also because they are not that thick, so we see that there are early changes that happen in anatomy in a very early stage in our age.
From your experience and expertise, what are the main concerns that your patients have when it comes to this area? And what are your top recommendations when it comes to treatments?
Exactly. So the top complaints that we see in this area is, for number one, dark circle. Number two, the wrinkles around the eye. Number three, the puffiness that we can see around the eye, and the emptiness, the hollowness that we can see. Those are the main four complaints that we see around the eye. And they can happen really at very early age. Like sometimes we see ladies at their early 20s, like 23, 24, and they really complain of dark circles around the eye. Now, we received a lot of questions about what's better. Is it filler for the under the eye area, or we recommend like the plasma? Let's go over them one by one. If there is any depression around the eye, and this can be evaluated by the doctor, yes, we need to put the filler in the under eye area. But this filler, it's safe, it can be done, we do it a lot, but it should be a specific product. This is number one. In this area, less is always more. We do not do a full correction. We do an under correction, and then we reevaluate. If we need to add more, we do that. It's very good to combine both things. So we do first the filler in order to elevate the tissues a little bit, in order to fill the depression that is there. And then afterwards, and this is one of the things that we do also together, that we do sessions of PRP. PRP has a major role in lightening the area, improving the texture of the skin, reducing the fine lines that are there under the eye. What are the treatments that are possible for the wrinkles? Number one, for sure, the botulinum toxin, the Botox or Dysport around the eye to reduce the lines that are in the crow's feet area. But for the fine lines that come here, we need to do treatments that helps to make the skin thicker. PRP helps. This is number one. Number two, microneedling also helps. Some types of laser. We do sometimes types of chemical peeling. All these treatments help. So as a summary, filler if we need it. This is number one. PRP has a major role in the rejuvenation of the around the eye area, and also all treatments that helps to rejuvenate the skin, like laser or microneedling or even chemical peel.
It's very important for both of us to be able to educate our viewers on the factors that might impact the health of the eye care area and this specific topic.
Mhm.
To what extent do hereditary factors play a role, lifestyle, our constant exposure to digital screens, um, eyesight issue?
Now, Now, number one is that we know that there are hereditary type of dark circles around the eye. The more the skin is darker, we see that there is a tendency to have dark circles around the eye. This is number one. Number two, it's very important to understand that all the factors that you mentioned, smoking, exposure to the sun, Also negative smoking, heavy makeup use. All these types of environmental factors can worsen and accelerate the aging process in around the eye area. Digital screens might make the whole area more tired in general. It doesn't have a direct effect on the aging, but it makes the area more tired. So it's important to try to reduce as much as we can.
Who are the best patients for fillers for dark circles? Now we're starting to read the questions from our viewers.
Yeah. Now,
Who are the best candidates for fillers under the eyes?
We don't use the filler to treat dark circles. We use the filler to treat the depression that is there, because when there is a depression, the area looks darker. So what we do is we fill the area, we make it more full, and we elevate it a little bit. So we make the area less dark, but it's not a direct treatment for dark circle. The best treatment for dark circle is mesotherapy and also PRP. Patients who have depression in this area definitely will benefit from the filler around the eye, and that gets rid of the tired look that a lot of patients they complain of.
Before we started this interview, I got a question on my DM asking whether vitamin E and putting vitamin E directly under the eye is a good idea. If yes, why?
Now we will see that the in the homemade skincare recipe that we will put today after our interview, it contains vitamin E, because vitamin E is a very powerful moisturizer, and it plumps the skin. So yes, it's beneficial. You just open the soft gel and you can put it directly under the eye, or you can use the recipe that we will mention later. There are one of the followers asked us about vitamin K. Yes, vitamin K can reduce the darkness around the eye, but there are a lot of products that contain vitamin K, can reduce the dark circles around the eyes. And we will also have a post on 3 top products that I recommend. The 3 of them helps to reduce the dark circle. First, number 1. Number 2, it rejuvenates the area. It really gives a good improvement of the eye area. We need to be patient, and we need to use the creams for at least 3 months to see a difference.
I know we talked about this briefly in the last episode of whether we should be applying sunscreen in the area, but since we're talking about eye care, let's talk again about the importance of applying even a little bit of sunscreen in the eye area, and what to do when we're subjected to the sun. What are the things to look out for?
Definitely, we should put a small amount of our sunblock under the eye area. There is no necessity to apply a specific type of sunblock. Just be gentle. But there are types that are specific for this area. You can use them if you want, but you can use your normal sunscreen as well. If you are exposing to the sun, go with the most trendy, fashionable eyewear, and have a big,
the biggest
big
one
sunglasses on your face. That will help to protect your eyes from the sun.
Let's talk about puffy eyelids. What is the number 1 treatment for that, and what are the reasons?
The puffy eyelids means that there is a hernia underneath, on the tissues underneath the skin, and the real treatment for that is the surgery. If the patient has this problem, I recommend her to do the surgery as soon as she can, because this will not go away on its own. If the case is mild, we can improve a little bit the area by putting a little bit of filler and doing the PRP, but it's minor. It's like a moderate improvement to the problem. But the main treatment is the surgery. We had a question about eyelid surgery. We are talking about blepharo, whether it is for the upper eyelid or the lower eyelid. Both of them, when it is required, I recommend the patient to do it. But it's very wrong. This is very important. It's very wrong to do it because we think that it will change the shape of the eye. Once we have a loose skin, whether on the upper eyelid or the lower eyelid, we can go for the surgery. If we don't have loose skin, it will not have any benefit. On the contrary, we might end with a scar, and the appearance might be worse from the baseline.
Is there a specific age where you recommend the eyelid operation?
It depends on the case, usually, but like 40 plus usually is the approximate time that patients start to see. Before we used to say 50 plus, but now patients are becoming more cautious about it. But definitely, it's not a treatment for people in early 30s.
Talking about whitening the white part of the eye.
Yeah,
Through
this is
later?
very this is something that we hear about, and this is it's not a treatment. There is no treatment for that, but some of the eye drops that can be used on the sclera make the vessels become more
Tight.
more tight. So it just shrink the circulation in the vessels, and that gives you a little bit whiter impression, but it's temporary. One thing, if you complain of redness on the white area of the eye, on the sclera, you should go to the ophthalmologist and do a checkup, because there might be a kind of allergy in the eye.
What are the key products to use to take care of the under eye area?
Now, it's very important to have a very powerful moisturizer. I prefer hyaluronic acid, because we know now there are a lot of research that the hyaluronic acid application on the skin can really reduce the aging in the skin. It increases the collagen production, and also it plumps the skin. So you need to look for a product that is rich with hyaluronic acid. We can use a very light retinol product on the eye area. Vitamin K is also possible. Vitamin C is also possible. Vitamin E is also possible. We are going to mention 3 products from 3 different brands. Those are my favorite products to be used on the under eye area. And during my experience, I found a very good effect on using them. But we need to be patient. We need to use them morning and evening continuously.
Tell us the secrets. Which products?
R2 R2 from Chioxan. This is the same company that manufactured the filler for the under eye area. We have from MAD. This is an excellent product. It's called Eye Transformation Serum. It has a little bit of retinol. It gives a very good improvement for the dark circles and also for the fine wrinkles around the eye. And number 3 is from SkinCeutical. It's called AGE eye cream.
Since we are giving our viewers tips on how they can use their fridge in the right way to create skincare products at home specifically during this this time, what do you suggest for this week's episode?
We prepared something for this week episode. Like put 2 teaspoon of green tea, boil it with 100 ml of water, and then leave it until it's cool down, and add 2 tablespoons of coconut oil with 5 soft gel of vitamin E. We just open the soft gel and we we empty the content in the soft gel. We mix them together. We can put them in the small container. You can apply this. It gives a very good moisturizing effect. Green tea is a major antioxidant. So, and the coconut oil also gives a moisturizing effect. You can use it as a mask. I recommend to use it 3 to 4 times a week. Very importantly, all the homemade recipes are things that can be additional to your skincare routine. Do not replace your skincare routine with those recipes. Those are things to make things easier, and you can use them additional to your creams.
Dr. Shadan's recipes will be posted right after this interview. We're almost we're out of time. A lot of people keep asking questions until now. I'm getting so many questions about the double chin and how to take care of this area and what are the main treatments. But we will be discussing other topics thoroughly in the next weeks to come.
One by one.
Exactly. I want to wish you a beautiful weekend. And I'm going to go into the kitchen and start that recipe. Thank you so much. Bye.
Bye.